tinatayang 19.1% ng transgender women sa buong mundo ay may HIV. Sa mga mahihirap na bansa tulad ng Pilipinas, ang HIV prevalence among transgender people ay maaaring umabot ng 17.7%. Nagpapatunay na trans people are among those most affected by HIV. And yet this population continues to be largely neglected. The Philippines may be a good example. Dito, noong August 2021, only 2% of the newly infected cases involved transgender women. But it is worth noting that for many, many years, trans women were considered as men who have sex with men. This erasure meant that they were not specifically mentioned, and so their issues were not specifically addressed. It can be said that many issues make trans people have higher risk for HIV infection. Para sa CDC, kabilang narito ang drug and alcohol abuse, sex work, homelessness, unemployment, lack of family support, stigma and discrimination, and negative healthcare encounters. So are we doing enough to be more inclusive of transgender people in our HIV efforts in the Philippines? Pag-usapan natin dito sa Bahaghari Talks. Kasama natin ngayon si Magdalena Robinson, Chairperson of the Dangal Pilipinas National Network of MSM&TG at President ng CURL sa Cebu. At si Jaya Jaod na bahagi ng Mujer LGBT Organization sa Zamboanga City. My first question to you both is this: are we doing enough to include trans people in HIV discourses in the Philippines?
Yes, actually part talaga siya as indicator ang transgender woman. On the HIV program, yun talaga ang parang target cases ang ating transgender woman. So we're doing it, lahat ng intervention, services for the transgender woman ay binibigay. Of course, andyan talaga yung testing, screening, yun. At the same time, yung adherence nila sa PRBs.
I don't like to hear or use the word enough because I think at the moment, trans participation in HIV discourses is more like a trial and error for me. And I think there's no specific services for transgender community implemented in the Philippines. It's just more on discussions. So we don't see the concrete actions at the moment. There's an advocacy that we really want to be adopted, which is a transgender framework for comprehensive package care for transgender people. So I hope it gets adopted, or maybe discussed first and then adopted soon by the Philippine National AIDS Council. So that's what we're looking forward. So it's not enough as of now, but maybe later on, if we can see concrete actions.
But for you, Magda, is the framework going to be enough to push for trans inclusion in HIV efforts?
I think it's the foundation of what we are demanding for trans health. So that's why it's very essential to have that, because that is the basis of all transgender services implemented by the government and maybe the program itself. So enough, we don't know as of yet, and how is it going to be used, utilized, and implemented. But I think it's very essential to have a transgender framework for having or adopting a comprehensive care package for trans people.
So what particular issues related to the trans community and HIV should be highlighted?
There is already a presence of transgender issues with regards to the data, like the transgender IHPSS of 2018. And it's just that how do we make use of the data, not just by the program implementers, but also from the transgender community. I think the transgender community needs to be empowered and to be capacitated to use that, because I think they are the priority to take action on the problems within their community. And so what I see is that there's really an incidence of HIV epidemic within the trans community, and I think we need to respond. Factors like HIV knowledge, access to treatment, syphilis, Hep C. There's still need to be done. If we really base it from the 1990 target, we are way too far to achieve the targets.
Ang ating mental health issues on the transgender individual, dapat tutukan yun. This would help them in preparing in terms of, pagdating sa ARB adherence. At the same time, tutukan din natin yung mga or gender-based violence ng mga ating transgender individual. Kasi lagi itong, nandyan, nakikita natin na nag-i-exist ang mga ganyang violence sa society, but then because trans, so parang hindi siya natutuloy. So with the help of the care officers, so somehow natutulungan sila in facilitating this case, but then ayun din, sad to say na lagi na lang sa settlement. So I think it's time na kapag may mga kasong kasali ang ating mga transwoman, dapat ituloy natin to. Huwag silang matakot. When they feel that they are right, then tuloy natin to. Laban nila to eh.
Even in the trans community, others may still feel excluded. For example, trans men and how HIV may also affect them. How do we make sure that they also get included when we talk about HIV in the country?
How do we ensure that no one is left behind? I think it's important for the trans community to really step up and demand for areas of engagement, participate in discussions, and really demand from the implementers that we also have stake. This is a problem. Actually, this is a problem of prioritization. And when you're not a priority, you're just sidelined. No? We are like that. Trans women are like that before. And so we can see an issue here with trans men not included in HIV discussions because, maybe they don't see yet. No, I think there's not enough data. So I think the trans men community needs to step up to make their voices heard. Maybe demand for to be reflected in the data.
Sad to say, that's true, no? Kung tutuusin ang healthy behavior ng ating mga trans men is much higher than the trans woman. So, pagdating sa HIV services, nakakaligtaan sila, it's because they're not part of the KPs, no? Parang pumapasok pa sila doon sa pagiging woman. Hindi siya napapasok at hindi talaga siya nakoconsider because of that indicators na ginagawa. But on the other side, binibigay naman yung salvation, no? Andyan yung, actually, luckily, we have this Love Yourself, Victoria, now catering talaga mostly of our trans men. Kasi doon sila talaga pumupunta for the health services, no? Napapasok din siya because some of our trans men are into sex work, may mga trans men na, indulging into, sex din. So I think it's there also, parang, obligasyon and duty to take care of themselves and to know their status.
You somehow touched on this already, but what are the other barriers to care that you know of?
Actually, the number one barriers to care is really a neglect on the needs of trans people with their transition. This is really born out from non-recognition of our identities, and because of that. We don't have hormone transition therapy, and of course, we don't have much expert to provide us with that kind of care, and that is a barrier to achieve full wellness, the full health. So I think there's really a need for the government to come up immediately with the guidelines on standards of care for trans people, including HRT, as well as other surgical procedures, for them to affirm their right to health.
This is obviously a multi-layered issue that also touches on stigma discrimination, sex work, and so on. Is it safe to say that there is an overemphasis on the medical aspect instead of also dealing with the other social issues related to this?
The response is more epidemiological. So I think there's really an emphasis to provide interventions of medical care to trans people who are affected, or are at risk of HIV epidemic. But the problem now is that they cannot efficiently respond because they do not consider, or maybe they do not respond to other aspects, no, with other social issues, like maybe vulnerabilities of trans people. And one of that is the non-recognition of their identities. They cannot be reflected um, in the simple forms, no, used by the service providers. So in HIV counseling and testing, it's still traditional gender binary sex in the form. So that's why in the data will not be reflected, and of course it's very awkward for us um, to provide our legal names and share our male identities somehow. So we really don't. It's really awkward, and it's really disempowering. It's misgendering to have that at the very first place. So that's why we say that it's really efficient. And of course, vulnerabilities. This There's still no policy addressing discrimination, and that's one of our vulnerabilities. Transgender people are mocked, or made fun at by the service providers, and if there's no existing non-discriminatory policy addressing that, then there's no reason for us to access the services, because we get discriminated if we access the services. So,
Well, right from the start naman talaga, nagkaroon ng programa talaga ang trans woman because of the HIV. So, doon pumapasok, kung nag-start talaga, doon pumasok yung mga programang yan. And thinking na si HIV program ang nagbigay ng doors to open a lots of issues ng ating mga trans people. So, ayun, na-highlight lang talaga yung health issues because of that.
the core of our health is more on affirming our identities. So gender affirming services is absent in our healthcare system. So that's one of our vulnerabilities. So we tend to overdose, or maybe access transition medications in black market, etc. Because there's really no guidelines for us, and of course this is a neglected issue by the government.
Considering these other social issues are not necessarily being dealt with, do we see changes related to HIV infection among trans people to happen anytime soon?
Changes in terms siguro of numbers. Kung dati-dati na yung prevalence ng transgender woman ay mababa lang, siguro tataas talaga at this time because majority kasi sa ating mga trans ngayon, they're focusing more on their beauty side, yung mga ganong bagay. So, pagdating sa health-seeking behavior in terms of sa HIV, konti lang ang nagsisik on that, and konti lang din yung nagsisik on the PrEP, yung mga ganon. So, they feel like ang magpe-PrEP lang ay talagang mga transgender woman na sex worker lang. Yung mga ganong issue na they don't want to be part, or ayaw nilang ma-label sila na I'm taking part because this is more on the sex. Yung mga ganon. So, I'm sure talagang ang ating in terms of the talagang tataas ang number ng ating transgender one pagdating po sa number ng HIV cases dito sa atin.
We will see changes if they're going to adopt a transgender framework for comprehensive care package for trans women. So if there's no if they will not adopt any transgender framework on for the health services for specific to trans, then I think we don't see any changes anytime soon.
Now, is the HIV community doing enough to ensure trans inclusion in existing efforts?
I think so. I think there's a support within the community, but still we are left behind in terms of prioritization.
Lagi naman, it's always been, ini-include talaga si trans, pagdating dyan, specifically doon sa trans woman. Yun talaga yung part kasi sila ng indicator. Ito yung parang, meron kasing target date. So, we need to concentrate on that. Naging baba lang talaga ang pagdating sa trans man lang. I think yun ang masasabi ko on that.
There's need for much advocacy to be done in order to, rally within the program implementers to provide transgender specific services immediately or on the spot. So, ayan, that's how I felt. Like, they're in support at the moment, but kulang.
What then should HIV-specific service providers do to ensure trans inclusion?
It's really forwarding community interest at heart. We should not forget that we are just a small portion of the stakeholders of the HIV response in the country. So sometimes communities are left out because they are not in authority. So that's why what can be done about that, what CSO can be done about that, anything that involves community interest should be supported, should be allied with.
Dapat ang ating mga CSOs na maging open na, like, let's start with our Department of Health, no? Dapat magkaroon na ng programa for the trans people. Parang pagkaroon na ng, kasi wala kasi yung trans pagdating sa mga department na yan. Same as with the City Health Office, walang ganun. So, si HIV program na nagbibigay ng intervention services on the trans people. So, paano maging matatag ang isang programa pagdating sa trans kung wala naman ito sa kanilang mandato or not even in their program. So, I think doon tayo lang mag-start and then pasukin na rin natin even doon sa services pagdating sa PhilHealth na wala rin ang trans woman involvement doon. Even doon sa mga packages nila ay hindi kasali yung transition. Yung mga ganun, that's unfair kasi we're paying it dapat we're not, hindi natin natatanggap ang dapat para sa atin. And isa din na gusto ko din i-emphasize yung dapat i-open na yung trans health package na kailangan ng mga trans individual,
There are really intersectionalities, the age, the occupation, what we do, our behaviors, our identities. There's a gender lens also. So there's really intersectionalities in us. And, our number one enemy is HIV epidemic. So that's why we really need to be together and support each other, with our agenda and our interests.
So for you, what is the responsibility of members of the trans community to ensure that their voices are heard when we talk about HIV in the Philippines?
Ay, attack! Attack talaga sa mga forums na, of course, that, concerns when it comes to HIV response. Kailangan joint tayo, engage. Citizen engagement is really needed for the trans to be included in all aspects of HIV response. And ayun, so kailangan talaga natin mag-participate even hindi tayo invited.
The formation of the LGBT organization is active. By barangay, meron na nga, So, and leading these are the trans, most of the LGBT organization, ang mga leaders nila ay mga trans. So, somehow, that kind of movement or that kind of formation na ginagawa, naririnig ang mga boses ng bawat barangay, especially for the trans community per barangay. So, ayun, lahat, iba-iba kasi problema ng mga trans kahit sa, iba-iba kasi demographics, so iba-iba din yung problema ng mga trans. So, through this leader, nakukonvince sila and then narinig yung mga boses na hinain nila. So, with that, kind of gathering. So it's a good venue na to know their issues and concerns.
Mag-ingay, mag-ingay if we're excluded because yun nga, they will just dismiss because wala namang nagrereklamo, so walang clamor to respond to the issues of the community. So kailangan mag-ingat.
Do you have any last words on this?
So my trans sisters and brothers out there, pagdating sa HIV, it's our obligation to test ourselves, to know our status. So don't hesitate or wag katakot to get tested. And sa transitioning, go for the recommended drugs. Say, that's for your own good as well. And meron tayong mga available methods of prevention. Access it, may libreng condoms and lubricants naman. You can also access the PrEP. So, let's be responsible for our body. So, yan, for our trans sisters and brothers out there.
We are really looking forward for having a direction, and that direction is from adopting a transgender framework as the basis for comprehensive package of care for trans people. So this is really crucial in the implementation of a transgender specific service, HIV services in the Philippines. So ayun, enough. Maybe it's really a work in progress, and we need to be proactive to adapt it as soon as possible.
Transgender people continue to be greatly affected by HIV, and yet they also continue to be neglected by existing HIV efforts. Dahil dito, two recommendations are worth highlighting. Una, ang mabilis na pagkilos ng service providers. The government, for instance, only started looking at data of trans people a few years ago, meaning for so many years, they were forcibly made invisible. Due to this invisibility, their needs have not been given solutions. Kasama na rito ang mga NGOs na hanggang ngayon, maaaring nakatutok lang ang mga programa para sa mga lalaki, bakla, at bisexual na Pilipino. At ikalawa, the necessity to include trans voices when coming up with HIV policies and programs that also affect them. Karamihan sa mga NGOs na nagsasalita, even on behalf of trans people, are actually not trans-led. Ibig sabihin, hindi nabibigyan ng boses ang trans people to talk about issues specific to them and how they think this should be addressed. And so we're rightfully highlighting this dito sa Bahaghari Talks.